All right, good evening. We've got quite a bit to do tonight, so we're going to try to cover 3 chapters. And I know this can be a little bit kind of intimidating, but what I would advise everyone to do is just sort of do one part at a time. So we'll start with terminology. And I'll talk a little bit about it in just a second or whatever. But what I would do is I would go through the slides with terminology and kind of listen to what I have to say. And then once you finish that, just kind of take a break for a little while and then kind of come back and you can do human body. Now, we've already done about 1/3 of the human body. We've done, I know Josh already done musculoskeletal, and he's done a lot of the heart. And I've already done the musculoskeletal, the skeleton, and then respiratory system. So what we'll do is we'll kind of take up with the heart, and there's maybe, we'll kind of finish it up, and then there's lifespan development. So what I would do is just kind of take a break in between. I know this seems like a lot of information or whatever, but just kind of take it in small bites, and that way it's not so intimidating. The other thing is, I know these your work that you have to do is due by Sunday night at midnight. So don't wait until 10 o'clock, on Sunday night, try to run through everything. I would kind of, again, just kind of start very soon, looking at it or whatever, and then kind of move on. That way, if you run into an issue or there's something you don't know, you've got a chance to look it up, or you can email us, or call us or whatever, to kind of talk about it. So, starting with terminology, if you look through your book, there is a great deal. I mean, there's pages and pages of terms and symbols and things like that. You don't have to know this stuff tonight or this week or even next month or whatever. And this is not, again, I'm going to kind of go over some of the basic terms tonight. I know you've probably already seen some of that just from kind of what we talked about. But we're just going to kind of give you the basic terms or whatever, and then we'll move on from there. Each one of these sections that we cover, like for example, when we actually start cardiology or the respiratory system or whatever, what the section actually does, or how it's kind of laid out is it actually starts with the physiology or pathophysiology of each section, and kind of how it works. Then the next thing is the disease process, and the third part of it is actually how to fix it. So, or actually how to treat it. So, at the beginning of each section, there's a pretty intense pathophys part of it. So again, you'll learn a lot of the terms and things that kind of go with that particular thing. It's kind of application, so it helps you remember. So as far as medical terminology, you'll hear, as long as you're in the medical field, you're going to hear medical terms. It's the language of medicine. And there's a lot of people use symbols or abbreviations or whatever, and a lot of people now, they're not using abbreviations. I mean, there are places in kind of forbid you using abbreviations, and the reason for that is the billing part of it. And the reason it's such an issue is CMS or Medicare, when you file a Medicare claim, you may have someone who, now I know they try to get medical people to kind of read your narrative, but they may have someone who doesn't know as much about terminology as you do, so they may, if they see something in there that's weird or they don't like or whatever, they can actually reject it. So it's a little cleaner according to some people. Don't use me as a term. But anyway, when you go into a hospital, when you go into a nursing home with your colleagues, you decide to go to paramedic school, whoever you're working with or whatever, you're going to hear people use medical terminology. So it's something you absolutely have to know. The other part of it is you'll learn terms your entire career. So it's not like that you're going to learn it all in a month or a year or whatever. It takes a long time to do it. So anyway, you do have key terms, symbols, and abbreviations or whatever, we kind of go over. And again, don't get caught up on this. Now, one of the things that we, at the very end of each chapter tonight, there's about a 10-question quiz. So what I would do is I would look at these quizzes or look at these test questions where because you probably will see them again. And the questions are pretty good. They're pretty good questions. So anyway, at least pay attention to them. So anyway, we're going to kind of learn how the terms are formed and the definitions of each part or whatever. And again, it talks about medical jargon here. We'll kind of talk a little bit about that. All right, this kind of is an important slide. Dysphagia means speaking, and you hear dysphagia a lot of times whenever they're referring to a stroke patient, because simply their speech is garbled. A lot of times their mouth is drawn downward or whatever, and they just can't speak. Dysphagia, again, look at the spelling of each one of them here. I mean, spelling is a big deal. So if you can't spell or you're having trouble, you may need to look this word up, to make sure that you're going to get by. So there's not much distinction between dysphagia and dysphagia. So there's not much distinction, but they both mean two different things. So, but anyway, you'll hear dysphagia when it comes to dealing with stroke patients for a long time. Anyway, cardio means heart, pulmonary means the lungs. So those are things that you need to remember. Whatever any cardio is referring to the heart. All right, this is kind of just a summary of the rules, whatever. You'll see some fun questions over this. The prefixes at the beginning of the term, affixes at the end. It says here the term that has more than one root word. We'll kind of go over this in a minute. I know this is a little bit confusing, but anyway, these numbers here are pretty interesting. Nulli, preemie, multi, a lot of that goes along with women who have had children. We'll kind of talk about that when we get into the OB section. So, and the other words, we'll kind of talk a little bit about those. Anyway, several colors: cyano, lupo. A lot of those mean red, whatever. Cyano means blue. It's means they're kind of hypoxic, or they don't have enough oxygen in the blood. So you'll see cyanosis kind of in the lips, and you'll see cyanosis in the nail beds at the root of the fingernails. So that just shows you don't have enough oxygen. So, all right, we'll talk a little bit about the directional terms, and kind of how pain radiates. So this is important. You'll hear this over and over. Superior means toward the top of the head. Inferior means near the bottom of the feet, or the feet. So, and this is a pretty good example right here. The knee is superior to the foot, inferior to the pelvis. You'll hear a lot of paramedics. You'll hear nurses. You'll hear doctors talk about inferior myocardial infarction, and that's a fairly common one that you see. Anyway, it's a myocardial infarction is a heart attack, and what it's referring to is an artery on the very lower kind of right side of the heart. And it being inferior, that means there's blockage in that artery, and it's causing to have a heart attack kind of in the right ventricle. So lateral is kind of the outside. So if you'll take a look at your leg, on the outside of your leg, that's referred to as lateral. Inside of the leg is referred to as medial. So you'll hear superior and inferior, lateral and medial. You'll hear those over and over and over again. Right, proximal, closer to the trunk. Distal is farther away. So your elbow is more proximal to the trunk than your wrist is, or your hand. So kind of keep that in mind. That's a good example. All right, superficial, closer to the skin. Deep is very, very, very deep into the tissue or whatever, into the silver skin, or I like the silver skin on the steak or whatever, that's the fascia. So that means if you can see that, it means it's very deep. All right, the word ventral and dorsal, now I think there's a test question over ventral and dorsal, but these are old terms. You don't see very many people use these terms anymore. So ventral being referred to is in the front or anterior surface. Now you'll hear anterior and posterior a lot, but ventral and dorsal, you won't hear that very much. So the dorsal is the spinal side of the body or the back. So you'll hear that over and over again. All right, palmar is the palm of the hand, and plantar is the bottom of the foot. So if any of you have ever heard of plantar warts or whatever, those warts, they're kind of on the bottom of the foot. All right. As far as the apex, now this is kind of interesting, and this is just, again, terminology. The apex of the heart is at the very bottom. And I'll kind of talk a little bit more about that in just a minute. And I know this is a little bit confusing, but the apex of the lungs is very top. So it kind of, and the reason for that is the electrical impulse kind of moves downward across the heart and ends up in the apex, stops at the apex, and that's where it causes a contraction. So we'll talk a little bit more about that. We talked a little bit about the movement terms, the bending of the joints or whatever. Covered the skeletal system the other day. So flexion is bending, extension is straightening, adduction is toward the midline, abduction is, as it says, your motion away from the midline. So again, this is just basic terminology. All right, bilateral, you'll hear this used over and over again. Let's say you have broken legs right here on both sides. That's referred to as bilateral femur fractures. So both sides is what it's referred to. Unilateral is only one side of the body. So kind of keep that in mind. But bi meaning two, so it's both sides. All right. This is important. Prone means lying face down, and supine means lying face up. So you'll hear this. You'll hear people referring to this over and over again. The Fowler position. There's actually two different parts of Fowler that they refer to as semi-reclining head elevated. That's kind of at 45 degrees. And then there's a high Fowler, which is 90 degrees. And that's like you put a patient on a stretcher and you set the head all the way up. That's a high Fowler position. You see that a lot of times with patients who can't breathe, so they have to sit almost straight up. It's very comfortable to be kind of in the Fowler position because the back is up, when you're kind of leaning back, it's pretty comfortable. So this is what we were just referring to. Again, semi-Fowler is 45, high Fowler is 90. All right. Nephropathy. Pathy means disease, and nephro means kidney. So you see this over and over again, nephropathy or kidney disease. It's fairly common. There's a lot of dialysis patients, and in fact, Central does a lot of dialysis transport. It's big business. So, and what it is people going to have dialysis a couple of times, 2 or 3 times a week. So they have to have transport back and forth. So anyway, a lot of kidney disease, but it's very, very, very common. All right, dysuria, means a condition of, or dys means difficult or painful, and urine, painful urination. Dysuria. So you see that. Hyperemesis is hyper meaning excessive, emesis meaning vomiting. So hyperemesis is excessive vomiting. Now here's another word that I'll add to it. Let's say you have hyperemesis gravidum. And what that is morning sickness with pregnant females. So you'll hear that referred to sometimes. All right. Analgesic. is without, or it's pertaining to no pain. So analgesic being anything from Motrin to naproxen to morphine, some sort of medicine that they get basically is what so it's referring to, analgesic being no pain. All right, shorthand. As it says here, some agencies limit the use of abbreviations simply because of the confusion that kind of goes along with it. What you kind of need to do is just look at what your agency recommends, and I'm assuming that most all of you have been through some documentation or whatever. So you've got to just kind of follow what your agency suggests. So anyway, there are some abbreviations or whatever, and you'll kind of learn these. Just make sure that once you start the abbreviations that you've got it, that you're doing it correctly or whatever, the spelling is correct. So there are some symbols or whatever, and so again, make sure that the symbols are correct or whatever. And we'll kind of go over these. So anyway, here's the first one of the questions. I'm going to move this upward a little bit. All right, so which of the following components of a medical term conveys its essential meaning? So is it prefix, suffix, root word, or combining vowel? So again, this is the pretty good question. So the root word. So all right, prefixes can indicate what? Color, condition, body parts, procedures. So colors, numbers, position, direction, or whatever, basically is what it is. So again, you can come back and you can replay this and come back and look at these questions again if you'd like to. And I know I'm going a little bit fast, but the reason for that is we've got quite a bit to cover tonight. So, all right, the plural form of the word bronchus is bronchi, bronchus, bronchiole, bronchuses, bronchi. So it's deep. So full form will always end in I, so you'll hear bronchi used a lot. All right, the lungs are superior to the bladder, indicates they're closer to, we've already kind of talked a little bit about this, they're closer to the head. So we've already kind of talked a little bit about that already. Right. Movement of the arm toward the midline is referred to as flexion, extension. So it's adduction toward the midline of the body. So again, abduction is away. All right, so the body part that lies closer to the midline compared to the other is medial, distal, lateral, and proximal. So it's medial. So again, you can replay these if you want to and look at them. And again, I'm going a little bit fast. So again, I mentioned earlier, I know this talks about the anterior, whatever, but dorsal or ventral, whatever, again, those are old terms. And you won't see them used that much. But again, ventral is toward the belly side, and anterior, the anterior surface, and posterior is the back. All right, so we just finished talking about semifowler a minute ago. So semifowler is at 45 degrees. We just kind of talked a little bit about that. So if they're setting it at 90 degrees, now I'll go ahead and give you a little bit of a field recommendation. If you've got them setting at 90 degrees, you more than likely will have to let the arms down on the side of the stretcher and let them put their feet off on the floor. And that makes them a lot more comfortable if you'll do it that way. Or a lot of people will demand to do it that way. So laceration located on the plantar surface is where? We already kind of talked about that a little bit. So it's the sole of the foot. So, all right. So again, when using abbreviations, acronyms, symbols, you should be familiar with what your agency uses. Use only what's medically accepted. Use them to shorten documentation. Yes, you can do that. So the best answer is what? It's all the above. Okay, so this ends the terminology part. I'm going to pull up the other section, and we'll start on it real quick then. All right, let's start with the heart. So this is actually a pretty good picture. So you really need to know this. Again, we've covered most everything up to here, and I think Josh has already covered this, but we'll kind of talk a little bit about it again, or just review it. So the right side is the low pressure side of the heart. So it pumps blood, from the body to the lungs. All right, a couple of things you need to remember. The left side is higher pressure. So if you look at the left side of the heart, and again, the picture that we're looking at here, it's kind of as the heart lays in your chest. So the left ventricle, which is kind of on the right side, because again, it's turned around as the heart as it lies in your chest. You'll notice the left side is much thicker than the right side, and the reason for that is it does a lot of work, and it actually pushes out the blood through the body. Now, it is not strong enough for it to push blood all the way through. And what I mean by that is it has to have some help from the right side. So the left side is actually pushing, and the right side is actually pulling. So there is some suction. It's a negative pressure. So one side is pushing, and the other side is pulling. So so blood actually makes it back to the right side of the heart through suction. So keep that in mind. Every bit of, if you have a heart attack that affects your left ventricle, every bit of the cardiac care now is aimed at trying to make sure that left ventricle survives. So they do all kinds of different things, to try to preserve that left ventricle. Because if the left ventricle is damaged to the point where it literally will not work anymore, then you end up with what they call a LVAD, a left ventricular assist device that's battery powered, or you end up on a heart transplant list, or the third option is you don't survive it. So you got to have the left ventricle. It is very, very important. All right, so you'll see this again. This is stuff you'll see on the test. So the normal resting heart rate is 60 to 100. The stroke volume is also about 60 to 100 milliliters or cc's. That's how they measure it. So the normal, we'll use 70 because that's what most of the books call for as far as the amount of blood. It's 70 cc. So what you can do is you can take your heart rate, multiply it by 70, and that gives you a cardiac output per minute. So again, diseased hearts or hearts that have been damaged or whatever, their cardiac output is not nearly as much. So you have a conduction system, and we'll kind of talk a little bit about those. So a little bit about the conduction system. You have specialized tissue capable of initiating and conducting electrical current or whatever. And again, this is one of the things that makes the heart so special is it has the ability to generate its own pulse. So, or actually beat. So there's three different pacemakers. There's one called the SA node that's up in the right, or not ventricle, but right atrium, in the upper part of the right atrium. You can actually see it. It's about the size of a pinhead, and it's yellow, looking about the same color as a little dab of butter. Anyway, what it does is it's the weakest pacemaker, and it generates an impulse, and the impulse kind of goes over the atrium, and it kind of comes together down where the at the beginning of the ventricles, whatever. The next pacemaker is called the AV node. AV means atrioventricular. So it has the ability to generate its own impulse or whatever, but it's much slower. And as you come down over the heart or whatever, you have what they call the Purkinje fibers, and they're actually in the walls of the ventricles, and they generate a pulse. They'll generate a pulse if nothing else is working above that. The thing about the conduction system you need to kind of keep in mind is it works on the all or none principle. So once an impulse starts, or once a cell fires or whatever, then the others will fire in tandem behind it. So it's very much like setting up dominoes. And then when you knock one domino down, then it kind of keeps knocking it. As long as they're close enough to hit, it knocks all of them down. That's pretty much the way the heart does. But once an impulse starts, it'll carry down over the heart, until it causes coordinated contraction, and actually allows your heart to pump. So you have the aorta branches into the coronary arteries, and those are the arteries that actually supply the heart. You have the carotid arteries in the neck that go up and supply blood to your brain. On the very underside of the brain, there's a little thing called the circle of Willis, and it actually is a big circle. So the carotid arteries come up to the circle of Willis. So you actually can have plaque build up in one of your carotid arteries. As long as the other one is open, then you'll still have enough blood to point to the brain. The hepatic arteries that's your liver. So it filters, and if you have your kidneys, and there's a very good blood supply to the kidneys. And just to give you an example of how important the kidneys are, if you have a low blood pressure, and we'll kind of talk about this in a little while, with systolic pressure, the upper number is less than 70. If the kidneys or the blood pressure is allowed to stay at 70 or below for an hour, the kidneys are not getting enough circulation, so they end up being damaged. So the kidneys are very important. Then you have the mesenteric arteries, and the mesenteric arteries actually go into the gut, and they provide the circulation into the gut, and it helps absorb, these arteries absorb nutrients, from which you eat, water, and things like that. So, all right, pulmonary artery carries oxygen for blood to the lungs. Now, pulmonary artery is a little different. This artery is the only artery that carries deoxygenated blood of the artery. It's the only one. Most of the arteries, or all the arteries, provide oxygen all over the body. Oxygenated blood all over the body. So you have a pulmonary artery carrying, it says oxygen for blood to the lungs, but then the oxygenated blood comes back through the pulmonary vein. So this is the only place where a vein carries oxygenated blood. The rest of the veins throughout the body carry deoxygenated blood. So I know some of you are saying, well, why is this that way? Why is it different? Why is it opposite to the rest of the body? And I'll kind of let y'all kind of think about that for a little while. We'll kind of come back. That sounds like this is pretty deep information. I'll go ahead and say that. But it's kind of interesting how it takes place. So we'll kind of talk about that a little bit. bit later on. I won't talk about it now. I want somebody to kind of look it up or kind of scratch your head and say, why is it that way? You know, if you care to do some research into it, you know, I mean, we can talk about it, but it'll come up again a little bit later. All right. So your pulse. Most easily palpated in the neck. The carotid is a very, very large artery, or in your wrist or your groin. Now, the femoral artery in your groin sometimes is a little bit hard to find because what you actually, in order to feel it, you actually have to compress the femoral artery against the pelvis. So sometimes you have to move your fingers around. So it's just easier to find a pulse in the neck or the wrist. Now, whenever you do this, whenever you're checking for the pulse or whatever, don't do it with your thumb. Because if you feel a pulse, your thumb has its own pulse. So if you use the thumb or whatever to press the neck or whatever, then you could be feeling your pulse rather than the patient. So anyway, the strength of the pulse is also a big thing. So the weaker it is, you know, I mean, it can be strong in the neck, you know, but then you can't feel it, you know, in the wrist. So that means it's maybe a lower blood pressure. We'll talk more about that later. So this shows all the arteries and all the veins or whatever, and it's quite a network. So again, the arteries bleed bright red blood, and it's pulsatile. So every time the heart beats, you'll see the blood spurt. Venous blood is darker, and it kind of just runs. It doesn't spurt. So that's a little bit of difference between those two. But now that doesn't mean that they both cannot. I mean, it doesn't produce a lot of. Either one can produce a lot of bleeding. So anyway, capillaries connect the arterioles to the venules. So it's the fine end of the divisions of arterial system and the beginning of the venous. So it says here it allows contact between the blood and the cells and the tissue, and actually perfuses the tissue is what it does. So the veins return oxygen to depleted blood to the heart. We've already kind of talked a little bit about that. The superior vena cava returns from the head and the shoulders and upper extremities. The inferior, and again, superior meaning up toward the head, inferior meaning from the lower in the body or whatever, from the brings blood back from the abdomen, the pelvis, and the lower extremities, and they kind of join at the right atrium. So. All right, the spleen, very important, and this will kind of come up, and I'll kind of show you where it is a little bit later. It's a very solid organ under the rib cage, kind of in this area right here. So it filters blood. It's very susceptible to injury from blunt trauma. So they used to, if your spleen was damaged, they would take it out, and people could live a fairly normal life, you know, without a spleen. But now, unless unless you've had a lot of trauma and the spleen is in 2 or 3 different pieces, they'll try to leave it alone and try to preserve it. So they may go in and cauterize it or do several different things. So it's all dependent on how bad the spleen is. It's damaged, you know, if you've had blunt trauma or a gunshot wound or anything else. So anyway, blood, this is very important. Plasma is the liquid. It's kind of a straw, yellowish liquid. Anyway, you have the red blood cells, and that's the erythrocytes. It's they actually have the hemoglobin, and that carries the oxygen. You have white blood cells, and although you know about white blood cells, they take care of infections and stuff. So platelets actually help with clotting. You have to have platelets in order to have clotting of the blood. So if you don't have very many platelets or whatever, then you've got you bleed very freely. So you have to have all of these. All right. So your blood pressure is the blood exerted against the wall of the arteries or whatever. So whenever your heart beats, it pushes blood through or whatever and puts pressure on the walls of the arteries. So systole is when the left ventricle, as it says here, contracts. It pumps blood from the ventricle into the aorta. The diastole is when the muscle relaxes and the ventricle fills with blood. So it's the relaxation phase. So systole is doing this, the contraction, and then diastole is relaxing. So with your blood pressure, whenever you put a cuff on and you put your stethoscope right here to listen, you'll pump it all the way up to around 180 or 200 or whatever. What you do is you apply a tourniquet to the brachial artery here. So once you've stopped the blood flow, then what you do is you start letting the pressure off of the blood pressure cuff, and as the pressure comes downward, once the pulse starts back, or once the tourniquet effect is over, or once there's enough air out of it to allow the blood to circulate back through, then immediately you'll start hearing a beeping noise. That initial number what you're doing is there's a little gauge right here that you're watching. So whenever when it first starts beating, that's the top number. And then when it kind of tails off or actually stops at the very bottom, that's the bottom number. So the numbers can be 140 over 80, 150 over 70, 120 over 80, 120 over 70, or whatever. So it all depends on when it starts and when it stops, and that's your blood pressure. And that's kind of a way to take a manual blood pressure. We're actually going to work on that pretty quick. So again, the systolic is the high point, the diastolic is the low point. All right. So you have to have perfusion, as it says here, and it's automatically adjusted and controlled or whatever. So in fact, I'll give you an example. Me sitting in a chair here, not moving around, I don't need, there's enough perfusion to my body to the point where it meets the needs of my body. But if I get up and start running around the building or whatever and exercising or whatever, then things are going to increase. So my breathing is going to increase, my heart has to speed up or whatever. So to basically eliminate, and we'll kind of talk a little bit about that in a little while, but it eliminates waste and it has to meet the needs. So hypoperfusion is inadequate blood supply to the organs, tissues, or cells. And you can have, there are all kind of different things that can cause hypoperfusion. You can have infection that affects that, or you can have someone who's been involved in some sort of traumatic event, from an automobile accident to a motorcycle accident, gunshot wound, anything like that, where they've lost a lot of blood. So that produces hypoperfusion. So there's all kind of other things that can cause that, but we'll kind of talk about that a little bit later. So your system, as it says here, can adjust to small amount of blood loss or whatever. And what this is that measures this is the baroreceptors in the carotid arteries and in the aorta at the very top of the heart. So the baroreceptors constantly measure the blood pressure, and it measures for any kind of blood loss. So anyway, mean arterial pressure is kind of the difference between the top or the systolic and the diastolic. I'm not going to talk much about that. So the blood, again, fighting infection or whatever, you have the white blood cells, transports oxygen, and it transports carbon dioxide. Now again, carbon dioxide is waste. So it has to eliminate it. You breathe it off through your breathing. So the pH is the blood actually controls the pH. And how it does that is it's called buffer system. I'm not going to get carried away with this, and you shouldn't either. So the buffer system is inside of your blood. You have what they call sodium bicarbonate floating around in your blood. And just to give you an example of sodium bicarbonate is baking soda that some of you may or may not use to cook with. That's what it is, sodium bicarbonate. You actually have that. It's a naturally occurring thing that's in your blood or whatever. So any kind of increase in acids or whatever, the pH takes care of that. And so it basically absorbs it or whatever it is, eliminated. So the other part about the blood is it transports waste and nutrients or whatever. And again, we've already kind of talked about the platelets, and the clotting that it actually does. All right. You have the sympathetic system, as it says here, the fight or flight response. So again, this is, I mentioned a minute ago about me running around the building or whatever. It's the part of your nervous system that becomes dominant when your body is under stress. Basically, is what it is. So any exercise, any running, weightlifting, all this different stuff, whatever, then the sympathetic system is dominant. So anyway, what it does is, as it says here, it sends commands to the adrenal glands. The adrenal glands are little appendages that sit on top of the kidneys. And anyway, they provide epinephrine, and it's the same epinephrine that some of you have seen in an EpiPen, for people that are allergic to bee stings or all kind of other stuff. And whatever. And then you have norepi, also referred to as Levophed, and that's a medicine that paramedics use to help maintain blood pressure. And what it actually ends up doing, the norepi, the epi, it stimulates the heart to beat, increases the rate of the heart beating, increases the rate of your breathing, or whatever, and it dilates and allows you to breathe faster. That's what it does. So norepi is actually causes your arteries to constrict. So whenever this happens, or wherever it constricts the arteries and pulls all blood into this area of the core, so it's kind of a survival type thing, if something bad happens to you. Right, so this alpha adrenergic receptors, the alpha means constriction of the arteries. And then you have the heart and lungs that beta receptors. So it causes the heart to beat faster and the lungs to open up. It causes bronchial dilation, or whatever. It causes the alveoli to open up. And with them opening up, then you have more, you're breathing faster, so you have more of an exchange of oxygen and elimination of carbon dioxide. So again, the baroreceptors sense pressure in the blood vessels. The baroreceptors, again, are in the carotid arteries and they're in the aorta. So anyway, you have the sympathetic, which speeds up, and you have the parasympathetic system that slows everything down. Now, again, when your body is under stress, you're running or you get scared or whatever, then your sympathetic system is dominant. But at night, when you're asleep, or you're eating or whatever, or I'm sitting in the chair or whatever, the parasympathetic may be dominant. So they have to kind of work in opposition of each other. You have to have both of these, because if either one of them became dominant, if you didn't have the parasympathetic system, the sympathetic system would just your heart rate would just get faster and faster and faster and faster to the point where your heart may be beating 500 times a minute. That's way too fast. You would not survive very long. Or if the parasympathetic system became dominant, then your heart rate would just keep slowing down and slowing down and slowing down to the point where you wouldn't have any heart rate or any heart rate. So these have to work in opposite of each other. So one keeps the other one from getting too far out of control. So you have the central nervous system, which is the brain and the spinal cord, and you have the peripheral system, which is the nerves out in the extremities or whatever, and then the legs or whatever are actually going to the muscles or whatever. So anyway, you see the brain here, and we'll kind of talk a little bit about this. You see the cerebrum, and you see the brain stem, and then you see the cerebellum. The cerebrum is the very largest section of the brain. There's more of it than there is in the other part. The cerebellum is kind of in the back, and it's very small. And then you have the brain stem. Now, I'll mention this again about the brain stem. The brain stem actually comes out through the hole in the bottom of the skull called the foramen magnum. I kind of mentioned this last week. The spinal cord and the brain stem come out through that hole. So again, the brain stem controls your heart rate, controls your blood pressure, controls your breathing. So if you have some sort of injury or whatever that affects your brain stem, then you're in a lot of trouble very quickly. So cerebral spinal fluid cushions and protects the brain and the spinal cord. And again, there's not a lot of it, but it's in a very small space. It's in what they call the dimensions. portion of the head, oxygenated blood is supplied by the carotid arteries. The deoxygenated blood is drained downward by the internal and external jugular veins. So anyway, here's your spinal cord. And I think I mentioned this last week. There's 31 sets of nerves that exit the spinal cord. These nerves kind of go out and around to all the different parts of the body, and they go into your legs and again to the organs. So you have the somatic and the autonomic. We'll kind of talk a little bit about these. So somatic transmits signals from the brain to the voluntary muscles. And again, the voluntary muscles are, I tell my hand to pick up my glasses or whatever, that's all voluntary. So the autonomic, again, you have to, so it's the involuntary stuff that you can't, you have no control over, like your breathing, your heart rate, your gut. If your gut's constantly moving, and it's processing the food that you ate. So that's it. That's kind of the involuntary side of it. And again, then you have two sides of it. So we've already kind of talked a little bit about the sympathetic and the parasympathetic. So two types of nerves within the peripheral system: the sensory nerves carry information from the body to the CNS, which is the brain. And then you have the motor nerves from the CNS to the muscles. So it kind of goes, the impulse goes back and forth, so it carries information back and forth. All right. Now this is the skin, also referred to as the integumentary system. The skin is the largest external organ. So I'll go ahead and mention that. Please remember this. If you see this on a test, and I promise you'll see it. The largest external organ is the skin. The largest internal organ is the liver. So anyway, two layers of the skin, the superficial, and then the dermis is the deeper part. Then you have subcutaneous, which is the fat, and it helps kind of as it says, it insulates and is energy reserve. So anyway, this is basically your skin. A good picture of it. So. A lot of nerves, a lot of arteries and veins, or whatever that go to it. So it does, as it says here, it does three things: protects the body from the environment. That's correct. It does. It regulates your body temperature. So with it being, it's been very hot lately. So with it being 90 degrees, you get outside and you do very much, or whatever, you're going to start sweating like crazy, and that's part of your body trying to regulate the temperature, trying to get lower the temperature. So it transmits information from the environment to the brain. And also, the other thing too that's not mentioned is your skin also tells you where you are in your environment. And what I mean by that is it does it with your ear. And your ear kind of tells you where you are, whether you're laying down, you're sitting, standing, So it also helps with that. So then you have the gastrointestinal system. So it's the abdomen, the second major body cavity. So anyway, you have 4 quadrants. So this is kind of interesting. There's a kind of a typographical error here that someone didn't catch. So you have the right upper. So it's supposed to be the left upper instead of the lower upper. It's supposed to be right upper, left upper, right lower, left lower. So we're going to talk about what's in each section here. So you'll notice on this slide, so if we're looking directly at the body here, you see the liver, which is a very large, round-looking, organ. Anyway, part of it actually comes over into the upper left quadrant. Not much of it. The majority of it's on the right, but then you see the stomach, the left upper, which you see the gallbladder. The gallbladder produces bile, and bile helps you break fat down. So the bile duct actually generates bile, which actually goes down into the stomach and actually into the gut. And again, helps break down fat. So you see the spleen here, they kind of lays kind of lateral and kind of posterior to the stomach. So again, it's just under the rib cage. So then you've got the small intestine, the large intestine, which they cover just about all of the gut. The appendix, been a lot of controversy and a lot of discussion about that for years. A lot of I've seen appendixes when I was watching surgery or whatever, they're 6 or 8 inches long, so it's not a very small appendage. I think the general consensus now about the appendix is it's not a part of the intestines that we need anymore. And they felt like, and a lot of the physicians and some of the pathophysiologists or whatever kind of suggested that the appendix was a part of the gut that we needed when we were more kind of cavemen, cave women, and we were eating roots and bugs and things like that. So we needed that part of the intestine to break stuff like that down. And now, since we're not forage like we once did, then we don't need that anymore. The bad thing about the appendix is it can become inflamed, and if it ruptures, then you can have a very serious infection that can actually cause death. So anyway, this is the other part of the digestive system. So it actually starts with your mouth. So when you start chewing, when you take that first bite of food and start chewing or whatever, that starts the digestive process. So, and this is not all of it. I mean, there's numerous different parts of it or whatever. So you've got the liver and then again the small intestine, large intestine. When you eat a meal, it takes about 24 hours for it to pass through. From the time you take it in by eating it until the time that you excrete it, so it takes about 24 hours for it to pass through. So anyway, there are enzymes that are added to your food. So saliva actually helps break you start producing saliva when you chew. So it actually starts breaking the food down immediately with you chewing. So and then there's enzymes that are produced in the stomach or whatever. A lot of acid in the stomach. Then you have enzymes in the liver, pancreas. Pancreas, produces insulin, so you have to have insulin to be able to break sugar down. So we'll talk a little bit more about that. So anyway, food is converted into basic sugars, fatty acids, and it's actually further processed and circulate through the body, for nutrients. So this is the lymphatic system. The lymphatic system is a part of your immune system, and the lymph nodes and the lymph gland, lymph vessels, or whatever, run very closely. You have the arteries and the veins and the lymph vessels, they're very close to each other. So you have little lymph nodes or whatever that catch any kind of pathogens or whatever that are circulated. The lymph is kind of a clear fluid or whatever. Then you have the thymus gland. The thymus gland is a gland around your heart that's fairly big when you're smaller or whatever, but once you reach puberty, it produces the T cells, which is part of the immune system. So once you reach puberty, then you don't need your immune system is fully functional by the time you reach puberty. So then from then on out, you should have an active immune system or whatever. You shouldn't have any problem. So your thymus gland starts kind of getting smaller and smaller every year of your life. So, and then there's, as it says here, there's other components or whatever. But anyway, it helps clean the blood. It catches pathogens and things like that. So again, it helps, as it says here, rid the body of toxins and other materials. So endocrine, very complex system, and it excretes hormones directly into the bloodstream. We'll kind of talk a little bit about this. It integrates just about every system. So I was just talking about the thymus gland, but then you have the hypothalamus, the pineal, pituitary. A lot of that's growth hormones and stuff that's produced. Then you have the thyroid gland, which is the master gland. The adrenal glands that sit on top of the kidneys, the pancreas, which produces insulin. Then you have the ovaries, the testes of the male. So we'll kind of talk a little bit about these. So now you have your kidneys, and your kidneys are very, very, very important. I know it talks about it controls the discharge of certain materials filtered by the kidneys. Controls the fluid balance. Yes, it absolutely does that. Filters and eliminates waste. It does control the pH balance. The other thing too that's not mentioned is your kidneys control your blood pressure. A lot of people don't realize that, but they actually control your blood pressure. So I mentioned dialysis a minute ago. If your kidneys stop working, you've got about 3 days to live, or you're either on dialysis. So anyway, this obviously is a picture of the kidneys and the bladder of a male. So anyway, here's your life support chain. So all cells require oxygen, nutrients, removal of waste, or whatever. So we've already kind of talked about this mostly. So anyway, if the cells become damaged or whatever, then there's issues. So this is important. We need to kind of make sure everybody kind of understands this. Aerobic metabolism uses oxygen. And if they switch to anaerobic metabolism, the oxygen is limited and you start producing all kind of acids, which in the cells cannot live in an acid environment very long. So as long as everything's working normally, aerobic metabolism uses oxygen, and aerobic metabolism is without. So that's something that you'll probably see on the page. So movement of oxygen, waste nutrients is by diffusion or whatever. We'll talk a little bit more about that. pH is critical. And, so your body, basically eliminates to maintain anything to get rid of that. And it does it through the kidneys. It can do it through the respiratory system, but it does it mostly through the kidneys. So if you're having trouble breathing, hypoxia means a lower amount of oxygen, or you're not, your body, as it says here, respiratory compromises the inability of the body to move gases effectively or whatever, so you become hypoxic, and that means you don't have as much oxygen, and you're retaining carbon dioxide, so that means hypercarbia. So I mentioned last week when I was talking about the respiratory system, we measure the carbon dioxide, and the number can vary from 35 to 45, but we always look at 40. So if you've got 50 or 60, that means you're not blowing it off, so you become hypercarbon. So hypoxia, you've got a pulse oximeter that kind of attaches to your finger, and it will kind of tell you. So anything below 93%, you start becoming hypoxic. So anyway, these are some things that impair your ventilation, like you get choked on a piece of chicken, any kind of impairment of your muscles of breathing or whatever, you've got a lot of broken ribs on one side, that would affect it. Asthma, one of the things that we're seeing now is, I know all of you have heard of COVID, the stuff about COVID. What happens is you end up developing COVID or whatever, and what these people end up doing is they develop COVID pneumonia. So this pneumonia produces a lot of mucus. If you remember, I mentioned last week that your respiratory system is lined with epithelial tissue, which is mucus producing. You're producing so much mucus to try to eliminate your body produces mucus to catch the pathogens, and you cough it up. What's happening is you're developing COVID pneumonia, and it's producing the pathogens just to overwhelm your lungs. Basically, is what it is. So you're producing so much mucus that you can't cough all of it up. It basically ends up blocking the alveoli to the point where there's no gas exchange. And that's why a lot of people end up in ventilation inside the hospitals. So some other things that will change or impair respiration, whatever, is high altitudes or any kind of impaired movement across the gas, movement of the gas across the cell membrane. Again, If you got someone who's partially drowned, and there's water inside the alveoli, then that affects the gas exchange. I mentioned a minute ago, COVID pneumonia, the reduction of all of the mucus, that affects it or whatever. But if you go way up, once you get above 10,000 feet, then the oxygen levels start dropping off. They're not 21% anymore, so they'll drop down to about 50 or 60%. It goes down. The higher you get, the more it goes down. So we don't see any of that here in the east because we don't have any mountains that are high enough to cause an issue. But if you get out west, when you get up on top of the Rocky Mountains, skiing or riding snowmobile fields or whatever. I've known some people who were here and they went to Colorado riding snowmobiles or whatever, ended up with what they call high altitude pulmonary edema, and they had to come off the mountains, because they got really cool. So affects respiratory compromise, oxygen levels fall, carbon dioxide increases again, respiratory rate increases, blood becomes much more acidic or whatever. So, and this is kind of a fairly, it can be a fairly fast process, but what happens is your brain sends commands to the body, and you're becoming, your breathing gets faster and faster. Basically is what it is. So you're trying to eliminate carbon dioxide. All right, so shock occurs when your organs and tissues do not receive enough oxygen here, as it says. So oxygen delivery is impaired. And again, there's a bunch of different things that can cause shock. I've mentioned urinary infections. You can have an injury. You can have a head injury to your brain or whatever, injury to your lungs, your spleen, your liver. Any of that stuff can cause shock. So we've already kind of talked a little bit about this, and I'm not going to get very much into this. We'll talk more about this when we talk about shock. So anyway, your major producer of energy is glucose, but you have to have oxygen with it or whatever. So we'll kind of talk a little bit about that. So all right, here's the first question that comes up. What is found in the retroperitoneal space? Retroperitoneal is in the back. So the liver is in the right upper quadrant. Spleen is in the left, in the left side, behind the stomach. So the only thing that really, and we know where the stomach is, we know where the liver is, we know where the spleen is. So the only thing that's retroperitoneal is kidneys. And please remember that retroperitoneal kind of goes with kidneys, so you will see this over and over and over again. All right, those of you that have had CPR should know this. So the tip of the sternum is the downward process. And I think probably all of you know that. So. All right, I mentioned bilateral femurs earlier. So is it a fracture of one femur or both femurs? So bilateral means two, so one on each side, so it's both femurs. You'll hear people refer to that periodically. All right, good question. Most prominent landmark in the anterior surface of the neck. Put your hand on the anterior surface of your neck and swallow, and you'll feel the most prominent landmark. And it's more prominent in a male than it is in a female. So it's the thyroid cartilage, referred to as the Adam's apple. All right, we talked about this a minute ago about the pancreas producing insulin. So, in fact, they actually come from what they call the Isle of Langerhans. That's actually there's a specific beta cells on the Isle of Langerhans that produce. You have to have insulin to break down sugar. All right, you may remember this from last week. What connects muscles to bones? The tendons connect muscles to bones. Ligaments connect bones to bones. So kind of remember that. You'll see this on the test. So I'd make sure that I knew this. So we talked a little bit about this. The resting heart rate is 60 to 100. So anything more than 100 is referred to as tachycardia. Anything less than 60 is referred to as bradycardia. Remember that. 60 to 100 is normal. All right, so the left atrium of the heart receives what? It's a good question. Receives oxygenated blood from the lungs by the pulmonary veins. So again, this is the only vein that carries oxygenated blood. I remember this. All right, we talked a little bit about this just a minute ago. Cerebrum, brainstem, cerebellum. It's the cerebrum. It's the largest part. All right, this is a good question. Which of the following statements about red blood cells is false? They contain iron. Yes, they do. They contain iron. That's partly what gives them the red color. They carry oxygen. They do. They have fight infection. I don't know about that. What helps fight infection? It's the white blood cells. So, and they give red color to the blood. So, yeah, they absolutely do that. So, all right, let's stop for just a second, and then I'm going to pull up the last part that we'll go over tonight. All right, let's talk about lifespan development. This will be the last part that we'll cover. Anyways, it says here humans develop throughout their lives, so we'll start talking about small children or whatever, and then it goes all the way through older people, and we'll kind of talk a little bit about each one of them. It's kind of interesting how you change. So, as it says here, you've got to be aware of the physical changes or whatever, and that kind of affects your approach to patient care. So, and there's a lot that kind of goes with it. So, a couple of things you need to remember here. You'll see the word neonate, and they're going to ask you what that means. So, neonate is always birth to 1 month. For many years, with paramedic tests, it always asked you what a neonate was. So you had to know birth to 1 month. Infant, 1 month to 1 year. And again, this statement about developing at a startling rate, absolutely they did. They developed very quickly. So the normal weight's about 6 to 8 pounds. Now that doesn't mean that there are not 10-pound babies. This is just the average weight is what they're talking about. So 6 to 8 pounds. So the head accounts for about 25% of the body weight. And when as it says here, they grow about, or they gain about 1 ounce a day. So the weight triples usually by the end of the first year. And the pediatricians pay close attention to that. So they measure the length of the children and their weight. So anyway, the cardiovascular system, when the child is being carried by mom in the uterus, mom is taking care of the breathing part, so the child is not breathing. So mom takes care of oxygenating and removing, and it provides circulation and any kind of nutrients, elimination of waste or whatever mom does. The placenta takes care of all of that. So anyway, when the child starts taking its first big breath or whatever, then there is a septum that comes up between that kind of moves upward and kind of attaches itself to the upper part of the heart between the atriums. And this is called the foraminal valley. That's what it's called. And so anyway, once the heart's three chambers when the child is inside of mom, but once the child transitions where it's independent itself, then it has to turn into a four chamber. A lot of things that actually take place here just within like the first couple of minutes of the child being born. Is the heart has to transition, the lungs, the alveoli in the lungs are collapsed. There's a lot of amniotic fluid inside of the lung. So the child has to take a big, deep breath in order for things to start occurring. In order for them to be able to, breathe on their own and exchange oxygen or whatever, and the circulation be normal. If for some reason the septum is between the atriums doesn't close, then I know all of you probably have heard of children who had murmurs, and that's kind of what this means. And sometimes it may take a couple of months for it to totally close. Usually it'll close within a matter of days, but if it continues for a while, a lot of it depends on how bad the murmur is. If it's a bad murmur, they'll take them to surgery and fix it. If it's small or whatever, they'll leave it alone. If the child develops or whatever, it will catch on its own. So anyway, this statement about younger infants younger than 6 months with prone to nasal congestion, and that is correct. They're primarily nose breathers, so they have a hard time breathing through their mouth. So if they have a lot of nasal congestion or whatever that means, they have a lot of trouble breathing. So they do have very large, floppy tongues or whatever, so the tongue can move backward and block the airway at times. So everything is just shorter and narrow. The head is bigger, so you have to be careful with that. All right, these are reflexes. This is kind of interesting or whatever. The moral reflex is the neonate opens their arms wide, spreads fingers, and seems to grab at things. The palmar grasp is you put something in the child's palm or whatever, and they will take it, touch their cheek, and it kind of is the rooting reflex. It's a feeding reflex, basically, is what it is. And then the suckling reflex is with the lips or stroke or whatever, then that's feeding. So fontanelles, and there's actually a couple of different fontanelles or whatever. You'll see one kind of in the anterior or whatever, and then there's one posterior. And I know it's talked to, most of them they close within anywhere from 6 to 18 months. Or they're totally closed from, anywhere from 6 to 18 months. And the reason you have these fontanelles is it allows as the child is being born and it's passing through the vaginal canal, these fontanelles allow the bones of the head to kind of move inward, so they flex a little bit, and it actually makes it easier for mom to give birth. Actually, is what it is. So by 2 months, they start tracking objects. And some are able to sit upright and they start babbling or whatever, and then 12 months. Now these are just general numbers here. There's nothing written in stone or anything like that. So if you've got a child that waited until they were 14 or 15 months or whatever, that's more all depends on the child before they walk. So the immune system, children have some of the mother's immunities or whatever immediately when they're born. But if they are breastfeeding or whatever, then they'll receive antibodies by breast milk. And they won't have too many problems until about 6 months after they stop breastfeeding. So this kind of shows you, and this chart comes directly out of the book. And so I wouldn't get, again, carried away with it. I wouldn't try to memorize this chart or anything like that. So anyway, all of you are familiar with the crying is the main method of communicating. So if the child's in stress or the child wants something or whatever, they start crying or carrying on. So and this thing about them developing relationship with their parents or caregivers, they do that. So So bonding is based on secure attachment. So you're bonding with mom or dad or whoever you're bonding with. And you will see this anxious avoidant attachment found in children who repeatedly, they don't bond with mom or whoever. Separation anxiety is fairly common in older infants. You typically don't see that until they're about a year old. So, and then this is kind of interesting. Trust and mistrust involved in infants' needs to be met. So if you're not meeting their needs, then they don't trust you. So, yeah, I'm going to kind of question this statement a little bit. Cardiovascular system of a toddler, 1 to 3, 1 preschool, 4 to 6, is not dramatically different than the adult. It is not different or whatever, but adults may have they may start developing atherosclerosis when they build plaque inside of the arteries. Little children don't have that, so that's the big difference with them. And then, of course, depending on that, I mean, there are people who have heart attacks, fairly early in life. So anyway, preschoolers, pulses 80 to 140 or rate 20 to 25, whatever. Then their blood pressures remain low for a while. So they do not have well-developed lung musculature. So you've got to be careful when you're ventilating them with a bagged out mask device. Their immunity is lost, so they've lost all of their immunity that mom gave them. So, and if they're starting to go to school, their immunity is gone. So any child they're around, or if a child comes in sick or whatever, then they all get sick. So a lot of times with children, the first year of school, they're sick. They're out sick more than they're there. So 28 months is about right for toilet training. So toddlers and preschoolers, they start to speak, and they kind of tell you what they want, and they're able to say no, yes, or whatever. A lot of times it's no. So anyway, they start to develop cause and effect, and what that means is it means if I do this, I'm going to get this results. That's what the cause and effect is. So they start understanding that. So 6 to 12, they start developing at a very quick rate. 4 pounds, 2.5 inches a year, permanent heat comes in. So there's a lot of brain activity in both hemispheres. So they kind of understand, this pre-conventional reasoning. They know what not to do to get in trouble or whatever. So and they kind of manipulate things or whatever. Sometimes there's a lot of drama involved. So they look for approval from peers of society or whatever. They develop a lot of self-concept and self-esteem. So 12 to 18 years, everything kind of levels off, and the vital signs are getting close to what they see within an adult. Now, this is kind of it can be a kind of a bad time. And what I mean by that is that they can have growth spurt or whatever, because it says girls usually are finished growing by 16 and boys by 18. So their secondary sexual development takes place, voices start to change, girls start their period, they start having acne or whatever. So they often, again, deal with conflict or whatever. Privacy is an issue, self-consciousness increases, where this thing about their own identity or whatever, there's all kinds of issues with it. There have been issues with 16, 18-year-old girls getting pregnant, eating disorders or whatever, high risk of suicide and depression or whatever. I picked a girl up once that got mad at her mother because they got into a big fight, or because her mother was wanting her to do the dishes, and she didn't want to do the dishes, so she went in and hung herself. And actually hung there for a couple of minutes or whatever, to the point she was brain dead. We resuscitated her, but she ended up being an organ donor, which was sad at 14 years old. So 19 to 40, as it says, vital signs don't vary greatly or whatever. Um, so this is kind of interesting or whatever. And I don't know that I totally agree with this. Life centers around work, family, and stress. That's true. Marriage and family, to a degree, yes, maybe not. And I don't know. I don't agree with this. One of the more stable periods of life or whatever. I don't know that I agree with that. Most males, and I know I'm being on males or whatever. A lot of them don't figure out what they want or what they're doing until they're about 30. And I've seen a lot of males that way. So that's why I question about it being more stable periods of life. So 41 to 60, big change. So, and I don't know about the vital signs or whatever, usually you're going to start seeing some high blood pressure, because of weight gain and things like that with middle-aged adults. So we'll kind of talk a little bit more about this. Vulnerable to hearing loss, yes, that's a big deal. Cancer, yes, cancer is a big deal in this age group. Females may start having menopause. Males have what they call andropause, where the testosterone level drops like crazy. Diabetes, hypertension, weight problems, so exercise and healthy diet, can help. So they're trying to make money, to be able to achieve life goals or whatever. So this is the big issue is a lot of times the children are going away or whatever, they may be paying for college. So the finances sometimes become a big issue. So they could be either caring for both children leaving for college and then aging parents. So it's sometimes an issue. So 61 years and older, life expectancy is constantly changing. Anyway, it's now, they say it's 78, that life expectancy for a female is 78, and it's 75 for a male. So it's all dependent on your genetics and your background, and a lot of it has to do with how old your parents were before they died. A lot of it has to do with that. So cardiovascular system declines with age, largely due to atherosclerosis, heart rate, cardiac output decreases, whatever. Vascular system, your arteries become stiff, and they lose part of the ability to contract and expand, like they did. So you don't produce as much red blood cells, so your blood volume is not quite as much. By the time you're about 70 years old, you've lost at least 1/3 of your total body function. You've lost at least 1/3 of your respiratory system. You've lost 1/3 of your cardiovascular system. Your kidneys, you've lost about 1/3 of your kidney function, your liver function. So by 70, you've lost about 1/3 of everything. So vital capacity decreases, whatever. That's your ability to breathe in and out very deeply, whatever. So that's a big thing. Chest is more rigid, whatever. So a lot of these people, if they fall, it's really easy for them to break ribs. It causes a lot of problems. Lung infections is an issue. They're very big on flu shots, and once you get 65, they're very big on flu shots and very big on giving the pneumonia shot. Those are the things. So insulin production drops off. So metabolism decreases, whatever. And if metabolism decreases, you don't need so much insulin. So a lot of these people will develop type 2 diabetes. So anyway, again, everything basically is just kind of going downhill. Your body's just kind of slowing down. So and this says decreases by 20%. The paramedic books say it decreases by 30%. So that's why I'm saying 1/3. So motor reflexes become slower. Sleep patterns change. And this is interesting. The neurons are lost, but there's no loss of knowledge or skill. And I'll talk a little bit about that. your brain does shrink, and as you age, and for an older male or female or whatever, this is kind of important. You know, let's say you go to, I'll give you a scenario here. Let's say you go to a nursing home and you pick up a little granny lady that's fallen and hit her head, and you get there and they have a bandage on her, you know, and she's sitting in a chair looking at you or whatever, and she has blood everywhere. Because she's got a pretty good laceration on her head. It doesn't matter if it's a male or a female or whatever, they need to be transported to the emergency department. The reason for that is you'll see here on figure 7-14, age-related atrophy and shrinkage of the brain creates a space. And that's referred to as the subdural space. Subdural is the venous side. Okay. So when the bridging veins are torn, then there's blood that accumulates in that area. Now it may take 2 weeks. If it's a very small vein or whatever, it may take a while for it to develop. So it may be 2 weeks before you see any changes in the level of consciousness. So what happens is these people need to go have a CT scan in the emergency department to make sure that there's no bleeding going on. And the way you document that, and I'll go ahead and mention this, is you tell them what happened, and then you put down patient was transported to the emergency department. Of course, CT scans will rule out a subdural bleeding. So, or a brain injury or whatever. So if you write that down, CMS or Medicare will pay for it every time, because if they know you're trying to take care of the patient, you're an advocate for the patient. So anyone in a nursing home, anyone at home who falls and hits their head or whatever, they need to go to the emergency department. So this is an issue. Reaction times are longer. So a lot of it's very common for these people to fall, and when they start breaking bones or whatever, it takes a long time for the bones to heal. So a lot of these patients, if they break something or whatever, then they may not even get over it. So it's a big deal. Most older adults can see and hear well. Some need glasses, some need hearing aids or whatever. This is interesting. Hearing loss is 4 times more common than vision. So, and that's pretty much correct. Right. I don't know that I agree with this slide. They say until about 5 years before death, most people retain a high brain function. And I'm going to disagree with that. I hate to do it, but I'm going to. Most of the people I've seen, they had a very high brain function until about 2 years before they died. Now, there can be all kinds of extenuating circumstances, whatever, and I understand that. And I want everyone to understand that. But my dad, he died about 4.5 years ago, and he was very cognitive, very sharp, had no issues or whatever until about 2 years before he died. And he just kind of started progressively kind of going downhill every month. He would feel a little worse until he finally died. So now this is interesting here. Statistics indicate 95% of the elderly live at home. And if they can be kept at home, or they can be taken care of or whatever, then they do a lot better staying at home than they do. Anyway, financial limits restrict access to health care, and not so much medications or whatever. They're trying to get the medications now where they're taken care of, so there's more assistance for medications now than before. But financial limits is a big deal. So this is interesting. This is pretty much correct. 50% of all women in the United States who are 60 years old or older are living at or below the poverty line. So what this means is if you've got a lady who's drawing $800 a month or whatever, and she may or may not be getting anything from her deceased husband. So these people of this generation or whatever, they pay their bills. I mean, they worry about the power bill or the water bill or whatever. They pay their bills. So the only thing that they can adjust, they know the bills are going to come, so they have to pay for those. So what they end up adjusting or whatever is if they're on medicine or whatever, then that's the only thing. They just take their medicine or groceries. Those are the only things they have any control over. So they have a hard time with this, and anyway, this thing about them facing their own mortality or whatever, it's an issue with a lot of these older patients, whatever, when their friends start dying. And that bothers them greatly. I know that. So isolation and depression is a huge issue, and it's even more of an issue now because of COVID. And a lot of people are, they won't get out in large crowds or whatever. So there are a lot of these older patients, they would might go to Walmart or to Ingles to get groceries. This is a huge issue for them. So isolation is a big deal. So in providing bag valve masks to an infant, what's the most important thing? So we've already kind of talked a little bit about this already. Blood pressure. So with a bag valve mask ventilation, you're breathing for the child, and the child's not breathing. So it has nothing to do with blood pressure. It has nothing to do about the infant growing or whatever, or the tongue being large or whatever. So it's referring to the lungs. The lungs are fragile. So what you want to do is make sure you've got the appropriate size bag. And we'll kind of talk a little bit about that as we go. All right, reaching out to people and drooling. So you'll kind of talk a little. Let's see. But 4 months, they're starting to reach out and drool. All right, we talked about this earlier, so it's anxious avoidant action. We talked about that earlier. So they treat their parents as if they were strangers or their caregivers. So why do colds develop so easily in toddlers and preschoolers? So they experience a loss of passive immunity. That's correct. They don't have well-developed lung muscular. They spend a lot of time playing around with classmates and playmates or whatever. So if anyone has a pathogen or whatever they bring to school, then they end up giving it to everybody. So the best answer is C, it's all the above. So all of the choices increase the likelihood of it happening. So portrait of toddler, this is something you kind of need to remember or whatever. So again, we'll kind of 90 to 150. All right. Good question. Conventional reason. Self-concept. How we perceive ourselves. Good question. Just finished our growth spurt. Disappointed. So, so anyway, this thing about terrified of being embarrassed, that's pretty much correct. So it does make them at a higher risk, for suicide and depression. So, this is a good question. Finance have become an issue during middle adulthood. So they're supporting their children. All right. Good question. Why is breathing more labor intensive for the elderly? The size of the airway increases, surface level decreases, natural elasticity decreases, overall strength of the intercostal muscles and diaphragm. So is it all the above? Good question. It is all the above. All right. That ends night's training. So please, again, don't panic. I know it seems like a lot of information or whatever, but just take it small bites at a time, okay?